Hi friends, once again welcome back to the Nurse channel. So as you all know, we have started a series named the AIIMS NORCET series to prepare you all for the upcoming AIIMS NORCET examination. So we have already uploaded so many videos in this series and we are very happy to see the responses from you people. Like we have received so many queries and so many requests to add picture based questions. So in this video also you can see many picture based questions and picture based explanations and application level questions also. So I request everyone who are watching these videos, kindly watch the video till the end without skipping, okay, because we have tried our level best to give good explanation for each and every question, okay. So whatever doubts or whatever queries or whatever suggestions you have, you are very free to ask and kindly comment in the comment box and we will try our level best to answer those questions and those queries, okay. So once again welcoming you all back to the Nurse channel, and without losing time we will move on to the first question. We will move on to this series which contains 15 questions which are taken from different topics or different areas of our nursing subjects, and these questions will definitely help you to prepare for your upcoming AIIMS NORCET examination. So we will move directly to the questions. So straight away moving on to the first question in our series. The first question is a very simple question, very simple question, and the question is here: calf pain at a dorsiflexion of the foot is positive for which sign? So question is very direct and very simple. Calf pain at dorsiflexion of the foot is positive for which sign? And the options are the option number A, battle sign, option number B, Brudzinski sign, option number C, Homan sign, and option number D, Cullen sign. So what is the answer? Calf pain at dorsiflexion of the foot. So obviously you know the answer, then the answer is C, that is a Homan sign, okay. So now we will see each sign in detail. So this is the way we have to elicit the Homan sign, okay. So Homan sign is used for the diagnosis of deep vein thrombosis of the leg. So a positive Homan sign means when the examiner is dorsiflexing the foot of the patient, what will happen is the patient will experience pain over the calf muscle. So that is known as the Homan sign. If the pain is present, then the test is positive for the Homan sign and it is thought to be associated with the presence of thrombosis, okay. So that is a Homan sign. Then we will see the another sign, that is a battle sign. See, battle sign means, see, in the head injury patients and all, you should be very careful about this sign, because this sign you can see in the mastoid area. So this is otherwise known as the mastoid ecchymosis, and it is an indication of fracture of middle cranial fossa of the skull, okay, middle cranial fossa of the skull. So head injury patients, this battle sign is important, okay. Then another one was the Brudzinski sign. So Brudzinski sign or the Brudzinski symptom, you know very well, it is a clinical sign in which there is the forced flexion of the neck of the patient elicits a reflex flexion of the hips, okay. So here the examiner is doing a forced flexion of the neck of the patient, and at the same time the reflex flexion can be seen in the hips. So that is known as the Brudzinski sign, and it is a positive. If it is positive, it is indicative of meningitis, that you know. And the final was the Cullen sign. So Cullen sign, you can see there is a periumbilical edema can be seen, and periumbilical ecchymosis, bruising also can be seen. So Cullen sign, it is a superficial edema and bruising in the subcutaneous fatty tissue around the umbilicus. So Cullen sign, as you know, Cullen sign is indicative of acute pancreatitis, okay, and for the ruptured ectopic pregnancy. So it was first developed, it was first invented about the Cullen sign when a patient was presented with ruptured ectopic pregnancy, okay. So those things you can refer later. So this is just an information for you. So Cullen sign is the periumbilical edema or the bruising around that is around the umbilicus, okay. So I think the first question is over. You are getting information about 4 signs. Now we will move on to the second question in our series, and this is from the OBG, and the question is, which type of pelvis is also called as flat pelvis? Okay, this is also a very easy important question. Which type of pelvis is called as the flat pelvis? And the options are the option number A, gynecoid pelvis, option number B, anthropoid pelvis, option number C, platypelloid pelvis, and option number D, android pelvis. So which one is flat pelvis? That is a question. Flat. So the answer is option number C, that is platypelloid flat pelvis. Okay, platypelloid. So we will see the platypelloid pelvis is otherwise known as the flat pelvis, and this is the least common type of the pelvis. Okay, so this is another information for you. Which among the following is the least common type of pelvis means that is the platypelloid pelvis, and it is wide and shallow, and it resembles an egg or oval. Okay, it is resembles an egg or oval lying on its side. Okay, those that is platypelloid pelvis. And another pelvis is the gynecoid pelvis. So gynecoid, you know that this is the most common type of the pelvis in females, and it is generally considered to be the typical female pelvis. Okay, so this is, you are getting two more information. That is most common type of female pelvis is gynecoid pelvis, and it is the typical female pelvis. Okay, and its shape is round, shallow, and it is open. Okay, now the third one is the android pelvis, and this type of pelvis bears more resemblance to the male pelvis, and it's narrower than the gynecoid pelvis, and its shape is more like a heart or a wedge. Okay, so here also getting so many information. So this is a male type of pelvis, and its shape is like a heart or a wedge shaped. And the last was the anthropoid pelvis. So what is an anthropoid pelvis? An anthropoid pelvis is narrow and deep pelvis, and its shape is similar to an upright egg or oval. Okay, upright egg, oval in shape. Okay, so that is anthropoid pelvis. Okay, so I think with this question you are getting information about the 4 types of pelvis. Okay, and our question answer is already explained. So now the third question is regarding a position. The question is Lloyd-David position is another name for which position? Okay, so which position is known as Lloyd-Davis position? That is a question for you, and the options are option number A, Trunlumber position, option number B, head down lithotomy position, option number C, SCTIMST position, and option number D, prone position. So what is the answer? Which position? That is Lloyd-Davis position, otherwise known as which position? So what is the answer? So answer is option number B, that is head down lithotomy position. So we will have a picture based explanation about these positions. So this is what is known as a Lloyd-Davis position, otherwise known as the head down lithotomy position. So this is lithotomy, and when the head is down, that is known as a Lloyd-Davis position, and it is a medical term referring to a common position for surgical procedures involving the pelvis and lower abdomen. So the majority of the colorectal and pelvic surgeries are conducted with the patient in the Lloyd-Davis position. Okay, so this is this is like a lithotomy position. See, the lithotomy position with head is down. Okay, so that is the head down lithotomy position, and this is a position which is used for the colorectal and the pelvic surgeries. Okay, I think that position is clear. So we will see the next question in our series. That is the 4th question, and the question is Klumpke paralysis is caused by an injury to which nerve? Okay, so you should be very careful about this question. Klumpke paralysis is caused by an injury to which nerve? So question is very direct. So the options for you are option number A, brachial plexus, option number B, cervical plexus, option number C, lumbar plexus, and option number D, sacral plexus. So which plexus injury can result in Klumpke's paralysis? So just think about this Klumpke's paralysis and how and when it is happening. Then you can answer this question very easily. So Klumpke's paralysis, answer is option number A, that is brachial plexus. Okay, so we will see the explanation for this question. So this is a picture for the Klumpke's paralysis, and Klumpke's paralysis is caused by an injury to the nerves of the brachial plexus, that which may result during the birth due to a difficult delivery. Okay, if there is an obstructed labor, or when there is a difficulty in labor of the child, that time Klumpke's paralysis can happen because it can cause a stretch injury or the neuropraxia, scarring or tearing of the brachial plexus nerves. Okay, so the characteristic feature of the Klumpke's paralysis is that you can see a claw hand appearance and wasting of the forearm muscles. Okay, there will be claw hand appearance and then wasting of the forearm muscles. Okay, so don't be confused with the Erb's palsy. So regarding the Erb's palsy, already we have explained in the old videos, you can refer that. Okay, so this is Klumpke's paralysis because of the brachial plexus nerves tearing, okay, during the time of a difficult labor. Okay, so I think that is clear for you now. Now we will move on to the 5th question in our series, and this is also a very important question, and the question is the aortic arch ends at the level of dash. So the question is regarding the arch of aorta. The arch of aorta ends at the level of. So the options are the option number A, second sternocostal joint, then T2 vertebrae, T4 vertebrae, T3 vertebrae. So at what level the aortic arch ends? That is a question for you. So what is the answer? So don't be confused with the starting point and the ending point. Okay, the question is regarding the ending point. So the answer is option number C, that is the T4 vertebrae. Okay, so we know that the aortic arch is the continuation of the ascending aorta, and it begins at the level of the second sternocostal joint. Okay, it begins at second sternocostal joint, and it arches superiorly, posteriorly, and to the left before moving inferiorly. And the aortic arch ends at the level of T4 vertebrae. Okay, T4 vertebrae, and you will get a more idea with this picture. So you can see that in the second sternocostal joint, it is starting. This arch of aorta is starting, and it is moving like this, and it is coming down, and it is ending at this level. Okay, that we have already explained in the T4 vertebrae level. Okay, and one more information that you know that from the arch of aorta, the major arteries are getting evolved, like the subclavian arteries here, then common carotid arteries, and the brachiocephalic trunk. So these three main branches are getting evolved from the arch of aorta. Okay, so I think that is clear for you. Now we will move on to the sixth question in our series, and this is from the dermatology, and it is a very important question, and it has asked several times in our examinations. The question is, a small patch of skin that is altered in color but is not elevated is called. So the question, you should be very careful. Question is, a small patch of skin that is altered. The skin is altered in color but it is not elevated. Then it is called as dash, and the options for you are option number A, papule, option number B, macule, option number C, erythema, and option number D, blister. So what is the answer for this question? So the key points are here, the skin color is altered and it is not elevated. So these are the key points in this question. So what is the answer? So the answer is option number B, macule. Okay, so we will see with the help of some pictures. So this is a picture of a macule. So you can see that it is circumscribed, it is a flat lesion with color change, and it is up to 1 centimeter in size, that is not palpable. Okay, so that means there is no elevation, no depression, nothing. There is a circumscribed flat lesion will be there. So that is a macule, and that is the answer for the question I have asked. And we will see the other options also. Then what is a papule? So we can see a papule here. A papule is a solid or cystic raised spot on the skin. See here in the nose we can see that there it is little raised. Okay, and it is less than 1 centimeter wide. Okay, so that is the difference between macule and papule. Macule means it is flat, we can't palpate and see, but papule means it is slightly raised, solid or cystic lesion. Okay, and it is less than 1 centimeter wide. Okay, so that is papule. Then another option was the erythema. So what is erythema? Erythema is always associated with the blood capillaries. Okay, so erythema is a type of skin rash caused by injured or inflamed blood capillaries. Okay, so we can see that see, this is very wide and it is reddish in color, and it is because of the blood capillaries inflammation. Okay, so that is erythema. Then another option was the blister. So blister, you know very well that it is an area of skin covered by a raised fluid filled bubble. You can see in the picture very clearly. So this is blister. So you can use the process of elimination and you can find out the answer for this question also. In our question it is clearly asked, it is not elevated and it is a skin rash and it is not palpable. Okay, that is obviously macule. So with this question you are getting information about macule, papule, blister, and the erythema. Okay, I think that question also is clear for you. So moving on to the next question in our series. So the next question is in your screen right now, and the question is, which mosquito is known as the tiger mosquito? So the question is, which mosquito is known as the tiger mosquito? And the options for you are option number A, Aedes aegypti, option number B, Aedes albopicus, option number C, Culex, and option number D, Anopheles. So which mosquito is known as the tiger mosquito? So what is the answer? The answer is option number B, that is Aedes albopicus. Okay, so we will see about the other mosquitoes also. They are also known by some other names that we will see in the explanation for this question. So this is the picture of the Aedes albopicus, which is known as the Asian tiger mosquito or the forest mosquito, and it is from the mosquito family Culicidae. Okay, so Aedes albopicus, it is from the mosquito Culicidae family, which is also known as the Asian tiger mosquito or the forest mosquito. Okay, so this is the picture of Aedes albopicus. albopticus. So we will see the other options also. So we had a Aedes aegypti. Okay, so this is the picture of the Aedes aegypti, and Aedes aegypti is otherwise known as the yellow fever mosquito. Okay, so the first one was the tiger mosquito. So aegypti is the yellow fever mosquito, and it is a mosquito that can spread dengue fever, chikungunya, Zika fever, and yellow fever viruses and other disease agents. Okay, so this is Aedes aegypti. Okay, now we will see the another option. This is a picture of the Culex mosquito. Okay, so you know that Culex are a large group of mosquitoes, also known as the common house mosquitoes. Okay, so Culex is common house mosquito, and these are the principal vectors that spread the viruses that cause West Nile fever, St. Louis encephalitis, and Japanese encephalitis. Okay, so that is Culex mosquito. Okay. So that is a common house mosquito, and the final one was the Anopheles mosquito. Okay, Anopheles mosquito is otherwise known as the marsh mosquito, and it commonly transmits the parasites of the genus Plasmodium, which can cause malaria in human in endemic areas. Okay, so that you know. So this is the picture of the Anopheles mosquito. Okay, so in that Aedes aegypti and Aedes albopticus, it is a little difficult to find out, but there are some differences that you can refer. Okay, so hope that was a very informative question for you. Now we will move on to the next question, that is the 8th question in our series, and the question is here. And the question is, what is the name of a disorder caused by methylmercury poisoning? Okay, so the question is very simple and direct. Name of the disorder caused by methylmercury poisoning. And the options for you are A. Plumbism, option number B. Copperidus, option number C. Minamata, and option number D. Alkali disease. Okay, so which is the name of the disease caused by methylmercury poisoning? That is a question for you. So what is the answer? Plumbism, Copperidus, Minamata, and alkali disease. So the answer is option number C, that is a Minamata disease. Okay. So we will have a small explanation. So high level exposure to the methylmercury is known as the Minamata disease. Okay, and in children this methylmercury exposure can result in acrodynia. This is another disease condition which is otherwise known as a pink disease, because in the skin becomes pink and it will become peels, and peels happens. Okay, so that's why it is known as the pink disease. Okay, so Minamata disease, methylmercury poisoning, and in the children it can cause acrodynia, otherwise known as the pink disease, because of the pinkish appearance of the skin and the skin peeling. Okay, so that is a Minamata. So what are the other options? So we have given other 3 options which are also names diseases for other substance poisoning. Like lead poisoning is known as the Plumbism. Lead poisoning is the Plumbism. Then copper poisoning is the Copperidus, and another option was the selenium poisoning causes the alkali disease. Okay, so these are the other options. Okay, lead poisoning, Plumbism; copper poisoning, Copperidus; and selenium poisoning, alkali disease. Okay, now we will move on to the 9th question in our series, and this is a picture based question, and the question is, identify the manure I have shown in the picture. Okay, so don't be confused with the manure while answering. Your options are, the first option is Phalanx manure, the second option is Heimlich manure, third option is jaw thrust manure, and option number D, chin lift manure. Okay, so you will be slightly confused, but you can answer this question very easily. So identify the manure. So what is the answer? So the answer is option number C, that is the jaw thrust manure. Okay, so we will see the other manures with the help of the pictures. So first we will see what is a Phalanx manure. First of all we will see about the Heimlich manure. So this is the picture of the Heimlich manure, and this Heimlich manure is otherwise known as the abdominal thrust. Okay, so abdominal thrust, also known as the Heimlich manure, is a first aid procedure which is used to treat the upper airway obstruction or choking. Okay, so the procedure and I am not going to explain now. I am just giving you a brief description, that's all. Okay, so abdominal thrust is otherwise known as the Heimlich manure. Okay, so the other option was the answer for the question we have asked, that is the jaw thrust manure. Okay, so what is a jaw thrust manure? So you can see the picture here. The jaw thrust manure is used to relieve the upper airway obstruction by moving the tongue anteriorly with the mandible, minimizing the tongue's ability to obstruct the airway. Okay, so this manner you can see the jaw is getting is pushed up to prevent the tongue from tongue from obstructing the airway. Okay, so this is the jaw thrust maneuver. Then another option was the head tilt or the chin lift maneuver. Okay, so this is the head tilt or the chin lift maneuver. So don't be confused with the jaw thrust. Okay, so the head tilt or the chin lift is a procedure which is used to prevent the tongue obstructing the upper airways. The purpose, everything is same, and the maneuver is performed by tilting the head backwards in unconscious patients, often by applying pressure to the forehead and the chin. Okay, so the pressure will be applied on the forehead and the chin and slightly elevating. Okay, so this is elevating the chin by tilting the head. So that's why it is known as the head tilt chin lift maneuver. Okay, so this is also to prevent the tongue obstructing the upper airways. Okay, so these three maneuvers. Okay, so that means the head tilt chin lift maneuver, the jaw thrust maneuver, and the open mouth maneuver. Okay, these are done together and it is known as the triple airway maneuver. Okay, so these three things are known as the triple airway maneuver. This is an additional information. And one more option was there in the beginning, that is a phalanx maneuver. So what is a phalanx maneuver? So this is the way how we have to elicit the phalanx maneuver, and it refers to a provocative test which is used in the diagnosis of CPT, that is CTP, carpal tunnel syndrome, carpal tunnel. Okay, carpal tunnel syndrome. Okay, CTS. So phalanx maneuver is a test used in the diagnosis of carpal tunnel syndrome. Okay, so with that question is also getting finished. Now we will move on to the next question in our series. The next question is regarding the rheumatoid arthritis, and slightly lengthy question, but it is a good question. Okay, rheumatoid arthritis, otherwise RA, is different from some other forms of arthritis because it dash. So this you can consider it as an application level question, and the options for you are: is more painful than other forms. Option number B, occurs below the waist. So option number C, it is symmetrical, affecting the right and left sides of the body. And option number D, it generally occurs above the waist. So just think about rheumatoid arthritis and the patients who are having the rheumatoid arthritis, and you can answer this question very easily. The question here is how rheumatoid arthritis is different from other forms of arthritis. That is the question. Okay, so what is the answer? I know it's a lengthy question, but just think and answer. So the answer is option number C, that is rheumatoid arthritis. It is symmetrical, affecting the right and left sides of the body. Okay, it can affect any part of the body, and it is symmetrical. Okay, so we know that rheumatoid arthritis, it is differs from other forms of arthritis because it is symmetrical, affecting both sides of the body. So other types of the arthritis, such as the osteoarthritis, it may affect only one side of the body. Okay, so that is a difference. And several times you will be confused with osteoarthritis and rheumatoid arthritis. And I have a small note for you. The rheumatoid arthritis is also characterized as an autoimmune disorder in which the body mistakenly attacks its own tissues, while the orthoarthritis, it is a degenerative condition that happens over time. Okay, so osteoarthritis is a degenerative condition, and the other hand, rheumatoid arthritis, it is an autoimmune disorder. Okay, so I think you got a small information regarding rheumatoid arthritis and osteoarthritis. Okay, so now we will move on to the next question in our series, that is the 11th question. So this is from the pediatrics milestones. Baby will be able to stand upon its own, stoop and squat by dash months. So question is very simple. Baby can be able to stand upon its own, stoop and squat by dash months. And the options are: option number A, 6 months, option number B, 8 months, option number C, 11 months, and option number D, 16 months. So when the baby can stand upon its own, stoop and squat. So you're right, your option number C, 11 months is the answer for the question. So we know that by the 10th month, the baby will figure out how to bend his or her knees and sit down. Okay, so he'll be able to figure out how to bend his knees and sit down, and by the end of 11 months or the past 11 months, the baby can expect it to stand on its own, but may take a few more weeks time to trace its first steps without anyone's help. Okay, so the answer for our question is 11 months. Okay, so I think that question also is clear for you. Now we will move on to the 12th question in our series, and this question is from the psychiatry, and the question is: which disease is also known as developmental coordination disorder, or DCD?
So the question is clear. Which disease is also known as developmental coordination disorder? So the key term in this question is coordination. So you can answer the question very easily, and the options for you are option number A, dyspraxia, option number B, dysphasia, option number C, dyslalia, and option number D, dyscalculia. Okay, so from the question itself you can answer very easily. So what is the answer? Which disease is known as the developmental coordination disorder? So obviously the answer is option number A, that is dyspraxia. Okay, so we know that dyspraxia, also known as the developmental coordination disorder, it is a common disorder that affects movement and coordination. Okay, so it is a disorder that affects only movement and coordination, and dyspraxia, it does not affect the intelligence of the patient. Okay, so it can affect the coordination skills such as task which requires balance, playing sports, etc. Okay, so there won't be any problem with the intelligence. The only problem is with the movement and coordination, that is dyspraxia. Then we will see the other options also that you know very well, but still I will explain. Like dysphasia means it is a language disorder which is marked by deficiency in the generation of speech and sometimes also in its comprehension. Okay, so there will be a marked deficiency in the generation of the speech and sometimes also its comprehension, that is dysphasia. And what is a dyslalia and dyscalculia? Dyslalia means inability to articulate the comprehensible speech, especially when associated with the use of private words or sounds. Okay, dyslalia is the inability to articulate comprehensible speech, which is especially when associated with the use of private words or sounds. And dyscalculia, as the name indicates, it is a learning disability in mathematics. Okay, so people with dyscalculia have trouble with maths at many levels. Okay, so the answer for our question was dyspraxia, that is a developmental coordination disorder. Okay. Now we will move on to the 13th question in our series, and this is from the lung anatomy, and the question is the volume of air remaining in the lungs after a normal passive exhalation. Okay, so this lung volumes, you can expect questions from these areas, and I know this is quite confusing also, so I'll try to explain about the 4 lung volumes with the help of this question. So answer this question first. The volume of air remaining in the lungs after a normal passive exhalation. So that's a question for you, and the options are A, residual volume, B, expiratory reserve volume, C, functional residual capacity, and D, tidal volume. So what is the answer? So the question is the volume of air that is remaining in the lungs which after a normal passive exhalation. Okay, so we have so many things like forced expiration, those things. Okay, so don't be confused. So I know you know the answer, and the answer for the question is option number C, that is functional residual capacity. Okay, functional residual capacity. So we will see each option in detail. So what is a functional residual capacity? That already we have explained, and it is a volume that is remaining in the lungs after a normal passive exhalation, and in normal individuals it is about 3 liters. Okay, so the volume that is remaining after a passive normal exhalation is about 3 liters, which is termed as the functional residual capacity. So we will see the other options also. What is a residual volume? So residual volume is the volume of air remaining in the lungs after maximum forcible expiration. Okay, so this is the, you should understand the difference between residual volume and functional residual capacity. Okay, residual volume is the forcible expiration, the volume of air that is remaining in the lungs after forcible expiration, but functional residual capacity is the volume of air that remaining in the lungs after normal expiration. Okay, so in other words, this residual volume, it is the volume of air that cannot be expelled from the lungs, thus causing the alveoli to remain open all the time. So to prevent atelectasis and all, we need residual volume, and the reference values for the residual volume is 1 to 1.2 liters. Okay, so this also you should be learn thoroughly, that the reference value for the residual volume is 1 to 1.2 liter. So the next option was the tidal volume. So you know tidal volume, it is the amount of air that moves in or out of the lungs with each respiratory cycle. Okay, that is inspiration, expiration, pause. That time how much air is flowing in and out of the lungs, that is known as the tidal volume, and it is around 500 ml in average healthy adult male and around 400 ml in healthy female. Okay, so 400 to 500 you can keep it as a range. Okay, 400 for female, 500 for male. Okay, and what is the expiratory reserve volume? expiratory reserve volume or ERV is the maximum amount of air that can be expired beyond the normal tidal volume expiration. That means the normal tidal volume, that is normal expiration, and beyond that how much you can expire, that is known as the expiratory reserve volume. Okay, so don't be confused with the residual volume. Residual volume is the amount of air that is remaining in the lungs after forcible expiration, and expiratory reserve volume is the amount of air that can be expired beyond the normal expiration. Okay, so the average ERV volume is around 1.1 liter in male and 800 ml in females. Okay, 1100 in males and 800 ml in females, that is expiratory reserve volume. Okay, so there are other lung volumes also that you can refer later, but I think I can explain very well regarding I explained about these four lung volumes. Okay, so now we will move on to the second last question in our series, that is a 14th question, and the question is, name the disinfectant agent in blood spill management. So the question is very simple, name the disinfectant agent in blood spill management. So who are working in the hospital settings can answer this question very easily, and the options are: option number A, 0.5% sodium hypochlorite solution; option number B, 1% sodium hypochlorite solution; option number C, phenol; and option number D, Dettol. So what is the answer? The disinfectant agent in blood spill management. So obviously the answer is 1% sodium hypochlorite solution. Then 0.5% for what purpose we are using, that we will see in the explanation. So we know that the sodium hypochlorite, commonly known as the bleach, is most frequently used as a disinfecting agent, and it is a broad spectrum disinfectant that is effective for disinfection of viruses, bacteria, fungi and mycobacterium. Okay, so here 1% can be used for the spill management and 0.5% can be used for the regular floor cleaning, especially in the hospitals. Okay, so that is about the sodium hypochlorite solution and the spill management. Now we will move on to the very last question in our series, today's series. So the question is an application level question, and just read the question carefully. The question is, the nurse is to administer digoxin to a 6-month-old. The apical pulse rate is 100 beats per minute. So the nurse should, what the nurse should do if the apical pulse rate of the baby is 6-month-old is 100 beats per minute and the nurse need to administer digoxin. So what should be the action of the nurse? And the options are, the first option is record the heart rate and call the physician. So I think the option is clear. The nurse has to record the heart rate and call the physician. The second option is the nurse has to record the heart rate and administer the medication. The third option is administer the medication and recheck the heart rate in 15 minutes. And the final option is hold the medication and recheck the heart rate in 30 minutes. So this is just an application level question. So in this question you should understand about the normal pulse rate for a 6-month-old, and you should understand what is a drug digoxin. So what can happen if digoxin is given. So those things you should keep in your mind and you can answer this question very easily. So what is the answer? So obviously the answer is option number B, that is you have to record the heart rate and administer the medication. Why? So why we have to just record the heart rate before giving the medicine? That is, we need a proof, because the heart rate I have given in the question is within the normal range for an infant, that is 6-month-old. That is, the apical heart rate is within the acceptable range for administering the medication. Okay, so the other option, so no need to record the heart rate and call the physician because it is in the normal range. Then we can administer the medication and no need for repeat the heart rate in 15 minutes. There is no use of that, and no need to hold the medication also because the heart rate is within the normal range. Okay, so I think this is a small application level question, and with that question we are coming to the end of this session, and I think the all 15 questions what we explained today is helpful for you, and I thank everyone who watched the video till the end, and I request everyone to share about this platform to your nursing friends and kindly make use of it. Okay, so once again thanks a lot, and see you soon in the other video. Till that time, just signing out. Thank you.